If you're like most folks Dr. Kris Fusterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris podcast. Welcome back, Dr. Kris. So good to see you. It's been a while since we've done a recording. How are you feeling, by the way?
I'm feeling good. Just kind of getting over, like you and I talked about before. We were out in Vegas a week and a half ago with Peptide World Congress. And, as I get older, you always, when you go to, well, first of all, Vegas, right? And then second thing is anytime we get together with we call them our second family, our peptide second family, we all get together and we want to stay up late and get caught up. And so it leads to less sleep. And and you're behind because you're not at work. So there's really always this 1 week of catching up, which was last week. So at least this week, last night when I went to bed, I felt like I was reasonably caught up on charts, and because I'm very OCD about my charting and everything. So I can kind of take a deep breath, feel like I'm somewhat caught up on patients, although the other things that we do never is caught up.
Yeah, so you and I have been missing each other because we've been at conferences, and I think people are like excited to get back and start mixing and mingle and traveling and stuff. But like you said, we get low on sleep, we're exhausted from travel, and you may hear it in my voice, but I have a little bit of something going on, and it's like, I'm in my mind, I'm thinking flu season's coming, and what are, I'm thinking about what are the things that I need to be doing? Because sometimes when I don't feel good, I don't go get my Alka-Seltzer Gold, or I don't do certain things, and I let myself get run down. And so I was just thinking today that we ought to talk about immunity and what the things that we could be doing to impact or upgrade, or whatever the word is, do better during this part of the season.
Yeah, you hit on some of the high points, but isn't it nice, that we're talking about something that's not necessarily COVID related? So that's cool. Finally having flu talk or just general respiratory illness talk versus specifically COVID. But really what we're going to talk about really covers all of that, COVID prevention as well. Isn't it also nice that we're talking about traveling and things that happen to us while we travel? Because I'm a firm believer that the masking up and the whether you're pro-mask or anti-mask, that's not my point. Okay. The point is that we were isolated so much, we wore masks so much that we actually somewhat have made ourselves more prone to getting ill now, because that constant exposure to different infectious type processes are important to keep our immunity high. Okay. We don't catch everything. And that's because our body is reacting. It's creating antibodies, has antibodies, keeping antibodies high, versus when you haven't been exposed to things in a really long time. And one of the docs that I really, really love, her name's Dr. Cynthia Keller, and she's an amazing concierge pediatrician up in Seattle area. And she was another one of these late night discussions in Vegas. And she was telling us how, well, first of all, in Seattle a couple of weeks ago, maybe still currently, they had the worst air quality in the world, not in the country, in the world, because of all the wildfires and everything going on there. But B, she has seen these normal infections that would normally be pretty mild, maybe some steroids or maybe some antibiotics or maybe none of that, just fluids and Tylenol, because of the air quality, but also combined with the isolation, masking. She is seeing tremendously worse infections with her respiratory patients. And then here's the next problem. They're having such a big outbreak in Seattle that they've created, and this isn't really being reported a whole lot. They've created, temporary ERs and whatnot in the parking lots of these hospitals because they're so overran. And so she was telling us how she had a patient that had an oxygen saturation that was very, very low. Normally goes right into the hospital and admitted, and the hospital's like, there's no way we can admit this patient. So she was keeping this patient during the day in her own practice, like having them stay there so they could give them updrafts and do all these things like they were in the hospital, going home at night, but during the day spending it with them to get them through these infections. And she was a firm believer that part of the problem is that we have been isolated, masked, and all these sorts of things. But good news is for most of us, we're kind of reacclimating, kind of going back out into the world. I think some of our fears, or maybe I didn't really have fear, but maybe people who did have fears are starting to let those fears go. And again, if you want to wear a mask, wear a mask. I tell everybody, do what makes you comfortable. I don't judge. I always say that person wearing a mask may have an immunodeficiency that I don't know about. Maybe they're just nervous about being in the real world again. So, but now comes traveling. And I think that one of the keys I try, and I'm not very good at this, by the way, when we travel, many of us get away from our routines, right? I always joke, Crisanta comes, and my wife, and she has like practically one suitcase full of skincare, hair care, supplements, peptides. And I show up with my little thing that has like a shaving cream, a razor, a brush, a deodorant, no supplements. I do usually take my peptides with me, but I do a very poor job. Because I think like, oh, I'm only going to be gone for 3 or 4 days, right? Like I'm only gone 3 or 4 days. I don't need that stuff. When actually that's probably when I need it most, because I am exposing myself to things that I don't normally expose myself to. And so I'm going to be around hundreds of people versus tens of people. And those people that are normally around me are in my inner circle, or they're my patients, versus just random people that you're going to be around shaking hands, especially like conventions. We're all shaking hands and having intimate interactions with people, freaking 1 foot from your face. And so it's probably the time to make sure we're doing everything right. So that'd be my first tip is let's all work towards whatever we're doing for our immunity. Let's keep it going when we travel. Let's not stop it. Let's not take 3 or 4 days off. And then also when we travel, and you spoke of it, but I just want to really discuss it, trying to keep our sleep patterns as close as we can to normal, like Vegas, Texas to Vegas, boom, you just went back in time 2 hours, right? So now 10 p.m. there is midnight here. And I know sometimes it's just impossible because you have things to do, people to socialize with, contacts to make, but try to at least try to get 6-7 hours of sleep. And the biggest thing that messes me up is I really don't drink that much anymore, except when I go to conventions. And again, I don't drink to get drunk, but I'll have 4 or 5 drinks in an evening, and it just, I wear the Aura ring, and it was funny. Leonard, the pharmacist that I lecture with a lot, we meet up the next morning, and he's like, "What's your Aura score?" And it's 0 to 100, and it's kind of like a test grade. You want it kind of like 85 or above. And I was like, "Man, mine was 57," and he's like, "Mine was 23." And so, I felt good that mine was 57 compared to 23. But it just goes to show when we get out there and we don't go to bed on time, we don't sleep as well, we drink alcohol, our heart rate goes up, we're not taking our supplements, you're just exposing yourself so much to infection.
I think the big thing for me when I talk to you is if we start and think about our cell, and if our cell is healthy, or if the environment of our cell is healthy, then it's taking care of everything else. When we're traveling, we're messing that up. We're not intermittent fasting on the regular schedule. We're just eating.
Good point. Yep.
Yeah. We're not sleeping as well. We're not, it's hard to keep our rhythm or our regular schedule on taking our vitamins and things, so that our cells are being exposed to more stress than normal.
Right, because some of this stuff does work like a battery. You can charge it up and it can last a while, but some things, you stop doing them and those benefits can really start to wane fairly quickly. And that's a great point about eating, like dietary. Maybe you're better than I am, but I go to these events and they always have a buffet breakfast, and hell, I'm a Texan. I'm not turning down a buffet breakfast, at the Four Seasons. You got to be kidding me. And so I'm like, heck, I'm here, I'm eating it, and I start to make bad choices. So I start eating early. What I always say about Dr. Seeds is he feeds us very well. So, it's buffet, good food, but still I'm not fasting. So breakfast, lunch, and then you go out with friends, you have dinner, and then usually you get back to the room, you've had 3 or 4 cocktails. Hey, let's order dessert,
Yes.
And so the food just really messes things up. And oh, great. What better thing to throw in your belly before you go to bed? A bunch of sugar. You want to really feed those, because viruses and bacteria like sugar. That's how they feed cancer cells. Not really for this talk, but they like sugar. So here I am just taking down all the fertilizer they need right before I go to sleep. But it's what we do. You know what? Life's too short not to have some fun. And I would tell patients, you know what? Go do all of that. Okay. Go have fun. Just try to minimize it. If we could just figure out the way to get some sleep at night, I think that would really, really benefit us. But also, like I said, making sure to take supplements, and we can discuss what, but, supplements and maybe peptides and things of that nature to just do the basics to keep you going.
Yeah. So even if we're not traveling, we have the holidays coming up. And so I think this theme is like, what are the top 3 things that we should be considering to either to quickly get back on schedule, or to manage this unusual, I guess, holiday schedule, we'll call it. And, and, and still think about not be, shaming ourselves for celebrating, but how can we continue to maintain a good mindset as far as keeping ourselves healthy?
Yeah, so this is not rocket science. I always tell patients the basics are really the most important. And there is a great product by that Orthomolecular makes called Orthoimmune that really has all of the things together that I like. But I think the most important one's vitamin D. As we always joke in our practice, we think it should be called hormone D because we have vitamin D receptors from our top of our head to the tip of our toes. Every organ system has vitamin D receptors. So we always joke it's more of a hormone than a vitamin, but they're never going to change the name to hormone D. So it's vitamin D. And vitamin D, very simply does a lot of things in our body. But the first, we have 2 different types of our immune system, but the first trigger is that innate immune system. And when your vitamin D levels are like 35 or below, it really can't initiate that innate immune system like it's supposed to. So I always tell, and by the way, we want levels like 50 to 100. And it is rare, and I just try to make this point with patients, it is rare that I ever check a vitamin D on a patient who doesn't take a quality good dose of vitamin D to be above 50. It's always like 28, 30, 32. And so because they're like, oh, I'm outside a lot. Well, that's not the way it really works. Okay. We're too far from the equator. We wear clothes. Ladies especially wear sunblock. Even my guys that go out in a lot of sun, they're smart enough to put a cap on. They wear long sleeves because they don't want to get burned. We're entering winter now, which changes everything. Darker skinned patients need more. So like in our area, to get enough sun, like in just shorts, no shirt, no pants, just shorts, it's like 5 to 6 hours a day. And I'm like, do you get 5 to 6 hours of uninterrupted sun? And of course the answer is no. I mean, hardly anybody does that unless you're on vacation. But vitamin D is so important for our immune system. It's important for our mood. There's a real reason why I always joke you go to the pool and you lay out for 30 minutes and you feel better. Well, yeah, it's because of a little bit of just emptying your mind out, but it's also that transient increase in vitamin D. And then also our bones. Most patients are not you're old enough like I am to remember this push that we had in the media and everything else about calcium. The average American gets plenty of calcium. That's not the issue. It's vitamin D is the issue, because calcium is basically cannot get where it needs to be into the bones without vitamin D. And so America went through these like decade and a half of more calcium, when actually the issue was actually more vitamin D. And it's inexpensive. It's easy to do. Second one, vitamin C. And no, don't get it from orange juice, please. That's always, I love my father-in-law to death. He passed away a few years ago, and he used to drink he was diabetic, and Crisanto would always just elbow me and tell me to shut up. He'd drink his orange juice in the morning for his vitamin C. And I'm like thinking in my head, oh my God, like, what is orange juice? It's nothing but a glass of sugar, right?
Sugar,
Water and sugar, right? Tastes great. I'm not saying it, but there's no nutritional value to that. Just get your vitamin C, from vitamin C. It's very easy to do. Get you at least 2,000 to 3,000 milligrams of vitamin C a day. That's a great thing. Zinc's really, really important too. So you can now buy these products that'll have the zinc and the vitamin C and the vitamin D all together if you wish to do those. Especially those are great things to start if you're going on a trip. But those are, COVID is still there. In my opinion, COVID's down-regulated. It's not nearly as big a deal as it was a year and a half ago, but we still have to think of these just simple supplements that we should be taking, these antioxidant type supplements to, just keep us going, keep our immune system healthy. But even more importantly, it goes back to exercise, keeping our bodies healthy, keeping our weight under control, what's a great way to kill your immune system? Insulin resistance. Become pre-diabetic, become insulin resistant. It goes back to our talks about, maintaining proper weight. A person that is unhealthy. So when you're insulin resistant, as we always talk about, what's happening? Well, we've basically got too much glucose. The glucose can't go into those cells and cannot be properly used. And what does that cause? It causes cellular dysfunction. So ultimately, insulin resistance is cellular dysfunction. And, now your cells are just dysfunctional all over your body, but specifically in the fat, liver, and muscle. So you've got to fix that issue, or your vitamin D and your vitamin C and your zinc and your echinacea and all those things that people love to take are going to help, but they're not going to fix everything. So, we need to start with a healthy body. So proper hormones, and very, very important for our immune function. Actually, in the state of Texas, when COVID started, there was a very brief moment of like 48 hours where we do a lot of hormone pelleting, where hormone pelleting was deemed we couldn't do it any longer because, they said that you couldn't do like cosmetic procedures. And, when they halted all that stuff and they put bioidentical hormone replacement under elective procedures. Luckily, someone got to our upper government and explained to them how hormone replacement affects your immune system negatively if you don't get it, and was very quickly added to the list. It came out on a Friday. We're all panicking, and on Monday it had already been fixed, and we were able to continue because, for like 3 months, we couldn't do simple things like Botox and fillers and facials and things like that because of, cross-contamination of patients. But yeah, it was funny how no one thought that a hormone replacement was an actual medical thing. It was just an elective procedure. So, it's the foundation. It's eating right. It's exercising. It's balancing your hormones. It's, taking those supplements. And then, of course, peptides. One of my absolute favorite peptides, thymosin alpha-1, TA1, is a extremely safe peptide that has been shown to increase T cells and B cells, the basis of our immune system, because as we get older, we don't produce as many. And we're always want to be very diligent in what we say about it. It's modulating the immune system. It's not upregulating, it's modulating it. And, from a guy to a guy, I always say that it's like an engine tune-up, so that when we hit the pedal, we get ultimate horsepower, we get ultimate performance of our immune system. If we don't hit the gas pedal, it's not doing anything. We don't want our race engine, running at 5,000 RPMs when it idles. And so it's basically what it's doing, and has no known side effects. Is a great way. It's something I've been on for years. One of my nurse practitioners asked me the other day, when's the last time you've been sick? And I had to think about it. I was like, Jesus, when's the last time I've been sick? Mm-hmm. And I honestly, and I'm probably going to get deathly ill tomorrow when I say this. I keep saying that I'm rolling the roulette wheel, but I think it's been 5 years. Of really, occasionally I'll wake up with a little bit of allergies and take a couple Zyrtex in a day and I'm fine, but I really can't think of an actual illness that I've had in 5 years. And I equate that to all of those things that we just talked about. Now, as doctors, we typically, if we take care of ourselves, have a little better immunity because we get exposed to anything and everything. And so, like a doctor I was talking to the other day, he got COVID and nearly died from COVID. Okay. And he's so funny. I'm gonna leave his name out of this because he probably wouldn't want me telling this story with his name attached to it. And so he got COVID really bad, actually was in the ICU and nearly died from it. It was very early on. His office manager, his father, his office manager did die on the very early stages of COVID. And he said that from then on, he's very active in his community, has a big practice, and he sees COVID patients all the time. And he said, man, after that, I would see a COVID patient, I'd take my mask down and be like, I need some more, like keep exposed. And he's like, I kept exposing myself the whole time. He's like, once I had COVID, I knew that if I would just keep exposing myself over and over and keep my antibodies up. And now it's been 3 years and he's never had COVID again. And I thought, wow, that's ballsy. But I get his point, like, let me keep my immune system up, and if I do catch it, it'll probably be a pretty mild case and I'll get through it because, he nearly died. And he, there's kind of some ways to look at that and completely keeping yourself from some of these diseases. And then when you're exposed, is a higher likelihood you're going to have much more severe cases versus constant exposure to it.
All right. So vitamin C, hormone D,
yeah,
zinc,
yeah. Echinacea is another good one. Those are just some of the most common ones. And no, your energy drinks don't have enough of it in it. Okay. I see some of these energy drinks now trying to promote themselves as immune boosting and things like that.
Sugar drinks. Yeah.
Yeah. And so, it's best. Like I said, we love orthomolecular around our practice and Thorne. Those are two of our majors. And you do have to go through a provider to get them, but orthomolecular makes an amazing product called OrthoImmune that really has all of so versus having 3, 4, 5 bottles, here's your capsules that have everything in it. Amazing company. They saw a need during COVID. And they're like, hey, these are what the doctors are prescribing. How about I just put it all in one capsule? And so that was very helpful. They listened, and it's nice to see companies that actually listen and do those sorts of things.
And then resting, exercise. And then you mentioned peptides. Obviously peptides, when you call it modulator, I think it sends a signal to your existing system to produce what it normally produces. It's not a drug. It's a signaling agent is the way I think about it.
Yeah, that's a great way to look at it. When people ask what is a peptide, I always say, well, they're amino acids in a chain. And they are mainly messaging. They're messengers. They cause many of these peptides, like TA1, we have naturally occurring in our body. Some we have made to mimic peptides, but TA1 in particular is something that we have in our body already, and we're simply causing a function to occur. I like to use the analogy, it's like being backstage at an old-timey theater. There's switches that you have to flip up and down, and basically these messengers are flipping switches, okay? And we're trying to flip switches in a positive way that through time many times get flipped down, okay? And so they're down regulated or just don't make enough. And so as we get older, it's like a lot of what we do with insulin resistance. We're trying to cause these different pathways to turn on so that we can create positive scenarios. but the body's amazing. And one of the things I tell providers with peptides is that, they're like, well, how much is too much? Well, okay, there's always, I guess, too much of anything, right? You can drink, as I always say, you can drink too much water. It's hard to do, but you can do it. The body always has negative feedback loops that still self-regulates these different things. It's one of the reasons why a growth hormone peptide is much better than exogenous growth hormone. Your body can still negatively feedback and kind of stop a pathway if it's going too crazy. And so that's one of the things I love about peptides is your body still has a way of regulating these functions. Kind of like vitamins, your body absorbs what it needs and urinates out what it doesn't most of the time. B complexes, that's another important one with immune system, making sure all your B vitamins are appropriate. Really when it comes down to it, having a good provider that is checking the appropriate lab markers. And, the one thing that really bugs me is, and I get it, but when patients come in and they bring their supplement bag and it's like this, I had one patient sent me and it was like this cabinet full of supplements and she's been seeing me for years. And I was like, I don't remember telling you to take 3/4 of that. Well, no, my friends will tell me to take this one and that one. And this was something I always tell providers, because as providers, sometimes we have a hard time because we feel like we're selling something. We have a hard time telling patients what supplements they should take. And and by the way, some of them I have on my shelf, and while you're here, because they're high quality and they're appropriately priced, if you would like them, they're here. So a lot of providers have issues with that. And I'm like, do you know that there's a high probability your patients are wasting $200 a month on supplements? Like, you're doing them a disservice by not saying, bring all those supplements in, because typically what my patients do, we'll throw away 80% of them. I mean, they're taking just concoctions, all this crazy stuff. So I really believe there's certain things that just, we use because we know we need them, but there's certain things we need to check levels and say, do you really need this? Do you not need this? Is that even a good quality supplement? Supplements are fairly unregulated in the United States. I always joke, but I'm not joking. You and Steve and I could create a supplement line and pretty much put it out there. And as long as we don't kill anybody and make crazy claims, no one cares.
We can even call it organic, and there's they did a study many years ago where they just pulled supplements off the shelves and they found that the vast majority had little to no product in it, which was on the label. Amazon, don't get me started on Amazon these days. There's some of the supplements that we sell here that you're not allowed to sell on Amazon. And one of the companies I work with has actually bought some of these products and tested them. And that they were just no telling what's in it, because what people are doing is they're copycatting the label, counterfeiting the label, throwing the label on, and you don't know what the hell's in the supplement. One of them had sawdust was in, one of them that they tested. So you just had to be really careful. It's one of the talks I go through with my new patients. Hey, I promise I'm never going to recommend anything to you don't truly need. And B, I do want you to buy it from us because A, it helps us, but C, I know that it's the quality that you need versus Amazon, because everybody loves to buy stuff off Amazon. And by no means am I saying Amazon's horrible. Hell, we spend a fortune on Amazon a month too. But I think Amazon should be used for certain things like toilet paper and paper towels, probably not your supplements. But anyway, that's just me. Or peptides. The peptides in that same category.
So one of the biggest questions I get is, why can't I not buy my peptides online? And I go, okay, well, first of all, there's a little disclaimer you have to check when you buy an online peptide that says that you understand these are for research purposes only and not from human consumption. That's the first box you got to check. The second thing is that they give you no dosing. So, if you think you're going to come to me and have me teach you how to dose this, because now I become roped into this once I start agreeing to dosing on this online peptide. I'm like, they don't give you dosing. So that's a second thing. So now you're Googling something to try to figure out how much to dose it. And then 3, we have no idea of the quality / purity of that peptide. No idea. Are they cheap? Yes. And that's where I stop with it. I like, if you want a cheap product that we have no idea if it's good quality product, go for it. But I'm not going to be part of it. We only buy from pharmacies that we know we can guarantee the quality of these peptides. Just like supplements, if Steve goes off and takes something for 3 months and you come back and you say, well, that didn't work, and you're kind of like blaming me, I'm like, hang on a second. I don't know what the quality of that product is. I can't even say, were you really even taking vitamin D? I see it all the time. Patients like, well, I take, you know what, I'm not going to name a brand. I don't want anybody coming after me, but I'd take a supplement from Walmart of vitamin D and I check their levels and it's 28. And they're like, but I take my vitamin D every day. And I'm like, yeah. And then you put them on our vitamin D and you check it in a couple months. And like, oh, it's 88. Like, imagine that. It's a good quality product. It actually works. So, and the crazy thing that I always try to tell patients is there really is no real cost savings with these things. You know, they just think because it's in a doctor's office, it's a lot more expensive, when that's just not true. Sometimes we're cheaper. You know, sometimes we're a buck or two more expensive. But typically the good news is when you have these kind of conversations with patients, because then they understand and like, oh, okay, I get it. You mean I can dump my $250 worth of supplements I'm doing right now, and maybe you spend $100, or I say, hey, you know what? If you have a $250 budget, let's maximize that $250 budget with supplements. Let's get some BPC in there. Let's do some things that's really going to change you. Let's not just you know, take haphazard supplements.
Excellent conversation, Dr. Kris. We could talk about this stuff forever, and we do over and over and over on this podcast. And so that's why we really encourage folks that are wanting to take ownership of their health. They're wanting to work together with a physician that is on the same page with them. These are the conversations that you should be having with your provider. And if you're not, then you can contact Dr. Kris, and either there's a potential relationship there, or he may have some great recommendations as well. Dr. Kris, anything you want to wrap up with before we call it a day?
Yeah, I actually do. One last tip that I forgot about: sodium bicarb, baking soda. A great cheap way to alkalize patients many times get very, you know, like this alkaline water and things like that, which in my opinion is kind of a BS thing. There's not enough alkalinity to really do much, and people can drink way too much of it. But anyway, as you know, I'm a big fan of Alka-Seltzer Gold. You have to actually specifically order Alka-Seltzer Gold. Amazon is the only place that I know. Locally, I do have one of my pharmacies that carry it because I ask them to, but Amazon, we'll give Amazon a plug on this one. It's a great way to get it because it's in the little Alka-Seltzer tablets, and it's just baking soda. You can put a couple of those maybe twice a day in a bottle of water and consume those. And it's a great way to, you know, really help the intracellular pH, turning it more basic versus acidic, which is not what all of these, which is really good for the cells and their function, but also these different things we get exposed to do not like that environment. So it's a really cheap, easy way to help your immune system as well. So I forgot to throw that one in.
Yeah, you reminded me. So I had a procedure recently, and they did these labs before I went in, and then of course I got to see the labs, and my alkaline levels were like super, just perfect as far as what you would want it.
Yeah.
You know, we eat meat. Most of us eat a high meat diet, and that makes us more acidic. Yeah.
Yep.
And so I was wanting to tell you, and I just thought of it now, so I'm bragging.
Yeah. So yeah, we most Americans eat a very acidic diet, and so our environment should be more alkaline. And so a nice way, of course, cleaning up our diet helps, eating more clean vegetables and things like that. But Alka-Seltzer Gold is a really inexpensive, easy to use. You can use plain old baking soda if you want. It's just a little messy. That's why we like the Alka-Seltzer Gold. Break them up, drop them in your water, drink them. Easy to do. So that'll be the last tip of the morning.
All right. Always good tips on the Dr. Kris Life podcast. Dr. Kris, they should know about your website, theresearchclinic.com, and then drkris.life. You can learn more about Dr. Kris. He's a speaker. He's a coach sometimes, but he's also a great provider. I can attest to that. And I guess we're going to call that a day. Is that a wrap?
That is. Thank you for your time.
All right. That's a wrap. Thanks for joining the Dr. Kris podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris podcast.